Hi there, my name's Lisa Ellis, and in this presentation I will be talking about the roles and responsibilities of a midwife. I will give a brief outline of the areas below. A discussion of the recent changes and the impact of the roles and responsibilities of a midwife. A discussion about the impact of the midwife in meeting the physical, social and psychological aspects and needs of the woman and the family. A discussion of the role of the Nursing and Midwifery Council in relation to the midwifery practice. An analysis of the implications of the Code on Midwifery Practice and the roles of the midwife. An explanation for the need for effective communication in a multidisciplinary healthcare setting. An evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. The Midwives Act was brought in 1902, recognising midwifery legally in Britain. However, even though this was the case, there still continued to be a large number of women who were supported by midwives who were not officially trained. These were typically local women who may have been older, who have had many children themselves. With the arrival of the NHS in 1946, more people were accessing healthcare, therefore access to qualified midwives and doctors, meaning it was safer to give birth should a complication arise. A better patient service is required for every woman because each pregnancy, baby and mother is unique. Their also experience during and after birth is a positive one. Better birth involves 7 essential areas. All women should be able to make their own decisions and choices of how and where they give birth. They have the right to receive support through their prenatal, intrapartum and postnatal journey from all healthcare professionals. A small team of around 4 to 6 midwives who are community-based should be familiar with the woman and her family so they can all provide continuity of care from pregnancy to the postpartum period. Healthcare professionals who are working together can ensure the correct care is given at the right time, meaning fewer errors are made. A board for maternity services is in place to monitor information being provided. Community and specialist mental health services are in place, meaning the woman can see her midwife as much as she feels she needs to. There are also health visitors for up to 6 weeks after she has given birth. All professionals need to work together, ensuring they understand each other and maintain respect for each other, so a better level of care is provided for her mother and the baby. Everyone working together as a team ensures women are making their own choices and have access to specialised care if it's required. This will improve outcome and lowers the chances of mental health illnesses. A fair pay system in place ensures all the midwives are paid fairly for their high quality care. Saving Babies' Lives is a programme that aims to reduce stillbirths, neonatal and maternal deaths. This goal will hopefully be achieved by 2025. It combines 4 aspects of care that have been identified as best practice. These are: there is evidence to suggest that quitting smoking in pregnancy significantly lowers the risk of stillbirth. Other issues such as early birth, miscarriage and sudden infant death syndrome are also reduced. Carbon monoxide testing of all women antenatally identifies the women needing a referral to a stop smoking service. Evidence suggests that fetal growth restriction is the leading cause of stillbirth. Therefore, diagnosing this in the antenatal period is critical in minimising the chances of stillbirth by delivering the baby quickly if at risk. The importance of spreading awareness to all pregnant women to be aware of the uterine movement is critical in reducing stillbirths. The woman should be aware of when their baby is moving less or has stopped. Babies who are high-risk labours need to be monitored using a CTG machine. If this doesn't happen, then babies have the chance of being born with a brain injury such as cerebral palsy. This would cause a huge burden on the families, as well as a financial burden on the health and social care system. Most pregnancies are thankfully low risk. Unfortunately, some pregnancies are high risk, and that's where antenatal care comes in. The National Institute for Health and Care Excellence have guidelines which recommend midwives to use antenatal assessment tools to access women during pregnancy using 5 categories. Pregnant women who are 40 years of age and over are at more risk of giving birth to baby with abnormalities such as Down syndrome. Also, teenage girls under the age of 15 and their babies are at risk of dying 5 more times than women in their 20s, according to the Save the Children study. Women with a high BMI are also high risk of various things such as miscarriage, diabetes, preeclampsia and high blood pressure. Previous women who have had a C-section or a postpartum hemorrhage will be at risk of it happening again. This can be life-threatening, so midwives will need to monitor the mother antenatally to minimise the risks. Similarly, the same can be said for women who have suffered with severe depression or at risk of it happening again. Women who have had conditions such as heart disease, epilepsy and diabetes will have to be monitored very closely throughout their pregnancy to minimise the risks of difficult and complicated births. Genetic conditions such as cystic fibrosis and sickle cell disease can cause problems. Thankfully, there are tests that couples can get to see if they are high risk. They are then offered counselling to access if they would like to start a family. Risks in pregnancy such as preeclampsia, twins or multi-pregnancies can cause problems for the mother and her baby. With preeclampsia, the mother suffers from severe headaches and vomiting, and the baby can't develop properly due to the placenta not giving enough oxygen. Blood tests are essential for all women in pregnancy to see what blood type they are. If they are rhesus positive, then the baby's blood cells could be affected, causing rhesus disease, which means the baby will have jaundice and anemia. It's the midwife's job to build a trusting relationship with the mum-to-be and her family. This starts at the very first antenatal appointment, where the midwife will help create a birth plan. She would give advice on where to give birth and what type of birth experience the mum and her family are likely to expect. In having a birth plan, the woman is able to take control of how she would like to give birth. It also helps others around her to know exactly what her wishes are. Quite often the birth doesn't go exactly to plan, but making one empowers the woman and may give her more confidence to give birth exactly how she wants to. Antenatal classes are a good way in which the midwife can support the woman physically, social and psychologically. The classes provide valuable information and practical advice on how to take care of the baby afterwards. New parents also have the chance to meet other parents to share thoughts and maybe make new friends. In some areas, classes are offered to same-sex parents, adoptive parents or single mothers. The arrival of a newborn is an exciting time for the whole family. However, the onset of labour can sometimes cause a great deal of stress and anxiety. The midwife is able to talk through what the woman can expect and also give her advice on what sort of things she needs to prepare for before labour starts. Having a bag packed and ready is useful, as is knowing what number to call when she is experiencing contractions. Many women who are expecting are concerned about what type of pain relief is available to them during labour. Midwives are able to advise them about the types of pain relief that's out there. The most common ones are: in antenatal classes, women are taught various breathing techniques in order to keep them in control and stay in control of their labour. Massage can also be an effective pain relief and helps keep the woman calm and relaxed. Gas and air is probably the most popular form of pain relief. It's a mixture of oxygen and nitrous oxide gas. This puts the mum-to-be in a relaxed state but can make her feel nauseous. Pethidine is an injection given in the woman's thigh to relieve pain. It can give you between 2 to 4 hours of pain relief but can affect the baby's respiration if given too close to the time of delivery. The epidural is an injection inserted into the spinal cord to numb the nerves to the brain. This usually gives complete pain relief but can have side effects that can result in an instrumental delivery. The TENS machine works by stimulating the body to release endorphins, which is in the body's natural painkillers. It's best used in the early stages of labour. The postnatal phase lasts for around 6 weeks after the baby is born. The midwife is responsible for monitoring the physical, psychological and social needs of the new mum and her family. The woman's body will have changed a lot during pregnancy and childbirth, so this is the time for her to rest and recover. The midwife will also advise her on things like sleeping pattern, appetite, diet, energy levels, regular exercise, taking walks in the fresh air and rest. In this postnatal time, the NICE quality standards from 2015 have the following recommendations for the mother's physical health and well-being. These are: the midwife will assess any perineal pain or discomfort the mother may be having and treat accordingly. The midwife is there to reassure the mother and her partner with regards to sexual intercourse, as many are worried about when they can have sex after birth. Women may experience headaches in the postnatal period, especially if they have had an epidural. A medical referral may be made if the midwife feels it's necessary. Here the women will ask, the midwife will ask the mother about the general well-being and energy levels. If the woman is persistently fatigued, then she should be checked for anemia. A mother who is experiencing constipation will be given advice on how to improve her diet and fluid intake. If a mother is experiencing fecal incontinence, then they may be referred for urgent treatment depending on how long it's been happening for. After giving birth, the mother needs to have passed urine within 6 hours of having her child. After childbirth, mothers are told of the importance of pelvic floor exercise. These exercises can strengthen the pelvic floor muscles and help prevent incontinence. Methods of contraception should be discussed within the first week of childbirth. Women can become pregnant almost immediately after giving birth, so it's very important. The midwife also needs to be sensitive and aware of any cultural or religious beliefs the family may have. It's the midwife's role to provide support for the baby's physical needs in the postnatal period. She will give advice on the midwife will provide help and support to regards to feeding her baby. This can be either with breastfeeding or bottle feeding. She will also help the mother to establish a new routine with her baby's feeding. It's normal for a baby to lose up to 10% of their birth weight after birth, but should regain it after 14 days. The midwife will keep a check on this and record it in the baby's red health book. If the baby is losing too much weight, then a jaundice check may be required. It's midwife's role to provide information with regards to the immunisations the baby will need. This information can also be found in the red book. The midwife will offer support and advice on how to care for the baby's skin, how to prevent baby from getting sore, bathing baby, and the umbilical cord. Some new mothers can be concerned about the colour of the newborn baby's poo. It's important for them to know what colour poo to expect from when the baby is born and how many times roughly a baby may poo in 24 hours. One of the most important pieces of advice a midwife can give a new mum is on safe sleeping for the baby. Baby must always be placed on their back with the feet at the end of the cot or crib, and midwives and parents must never share the bed with the baby to reduce any harm that could happen to the baby. It's also very important to warn new parents of the dangers of smoking around baby. As any parent knows, when you become pregnant for the first time, it can be a very exciting but a very challenging time. Even for the parents having subsequent children, having a new baby can bring its own challenges, as the siblings have to adjust to the arrival of a new baby. Nice Quality Standards have made the following recommendations for mental health well-being. Every time a woman has contact with a midwife, they should be asked about their emotional well-being. It's important to know and understand who the midwife support network is and how they are in themselves. It's important for all healthcare professionals to be aware of any signs and symptoms of maternal health problems in the postnatal period. Women who are experiencing low mood or baby blues will need support and advice from a midwife. If this doesn't improve, then the woman may be assessed for postnatal depression. Advice and support can be given to the mother on how to care for her mental health, as she can often forget her own needs whilst caring for the baby. Encouraging the new mother to talk about her feelings and worries is very important, as this postnatal period can be very overwhelming and sometimes isolating. The NMC is a registered charity which started in 2002. It's the regulator for every midwife and nurse practicing in the UK today. The main roles of the NMC are to maintain and update a list of all nurses and midwives who are eligible to practice in the UK, to review the education, code of conduct, training and performance of midwives, to investigate any allegations made against the midwife. The NMC is there to protect all midwives and the public. It also ensures midwives maintain good, high standards, providing excellent care to all women and her family. Keeping midwives up to date with education is essential, as in keeping with the mother and her baby safe and happy. They must be expected to know everything in the antenatal, interpartum and postnatal period. They must be aware of any possible complications that could occur and be able to communicate with the mother effectively. They must have a good understanding of illnesses that pregnancy can cause and also be able to show the mother how to care for herself and her baby. Midwives need essential skills in order to recognise antenatal, postnatal complications such as hemorrhage, eclampsia, depression and mastitis. The NMC is also responsible for investigating any allegations made against a midwife. If their standards are not up to the required criteria that is set, the NMC may deem it necessary to remove the midwife from the register, either permanently or a set time frame. The code contains the professional standards that all midwives and nurses need to follow. It started on the March 31st, 2015 and has 4 key sections which the midwives are expected to do. These are: prioritise people, practice effectively, preserve safety, and promote professionalism and trust. Midwives must put the interests of care in the safety of women at first. They must always be respectful, making sure that the woman's rights and needs are met, and that her privacy and dignity are always a priority. Midwives must always work to the best of their abilities. They must all work together as a team and communicate clearly, making sure all documentation is current and up to date, and to be responsible and accountable for their decisions. The code states that midwives must make sure the public are protected. If they believe their women or the public are at risk, they must raise their concerns. They must offer advice wherever possible during the antenatal period, such as a healthy diet and looking after the woman's well-being. In the intrapartum period, they must be aware of anything which could trigger a concern, for example, a drop in blood pressure or a reduced fetal heart rate. Postnatally, the midwife should be able to recognise the symptoms of postnatal depression or emergency situations such as postpartum hemorrhage or eclampsia. The midwives must make sure they always conduct themselves in a professional manner. They must not discriminate and always act with honesty and integrity. They also have a responsibility to keep their knowledge and skills up to date by regularly doing courses and training exercises, and also have 24-hour access to a named supervisor who they meet once a year. In order for healthcare professionals to be successful, they will need to listen to each other, have trust in their colleagues, understand their own responsibilities and what their job role is, and have respect and share ideas and information wherever possible. Teams are made up of a variety of roles. This could be: these team members are usually brought in when there's a complicated situation, as they have different qualities and specialities which they can offer. Cross-functional is where members of the team have similar skills. They work together and support one another to achieve the same goal. Multidisciplinary is where a group of healthcare professionals with different job roles work together to meet the needs of the patient. They should have a good understanding of their own specialty and expertise in order to meet the needs of the woman and her family. They must also be able to share information correctly and accurately, otherwise there may be misunderstandings which may lead to mistakes being made. If communication is used effectively, better care can be achieved. It may mean there is more than one opinion of a treatment plan. This would especially be useful in midwifery when there's complicated pregnancy or birth. The professionals can share their ideas on the best way to care for the mother and her baby before and after birth. To conclude, the roles and responsibilities of the midwife are very complex. The NMC is there to help regulate the profession as well as supporting the midwife. As we have heard, good communication within a healthcare setting is paramount in order to make sure every woman and her baby have the best possible care. Thank you.